officially.
Janet Hilber, who usually has things like our name plates and the typewritten agenda, but we're going to be a little less formal today. I suppose, but first I will do
Although she will do the minutes.
She'll do them if we, okay, this is like, it could go, the downside is if we lose Zoom.
Then I'll do the minutes.
Or me, so I said to any of the missing members of the committee beforehand that I would personally write up what happens today, just to try to alleviate any issues there. Okay.
Okay. So I'll do the roll call. Rep Burnham is excused. Rep DeRoy is excused. Miles England
Present.
here. Al Howland
Here.
Rep Kaczynski.
There.
There you go. That's Rep LaMontagne. Rep La Rochelle.
Present.
Kelly Rep Potenza is excused. And Janet Wall is not here, but I was expecting her. Okay, and Rep Schmidt is here.
I'm not on.
Correct.
You're
The other, and Susan Rice is here. And commissioners, and Mr. Bauer. Okay. So first order, do we want to approve the minutes from the last meeting? Which everyone should have received and by email,
I'll make a motion to approve the minutes from, what was the date on that?
the 15th.
The 15th of August meeting.
I'll second that.
Is there any comment? No, so motion to approve has been submitted. All in favor?
Aye.
Okay, any opposed? Okay. Okay. So we requested some more information from.
Hi, it's Tom Southworth calling. I'm running out of medication, and apparently there was a problem with the shipping, and
So one issue, we wanted a little clarification as to why the current nursing home population is only 170. Because Mr. Bauer put in his email, as you've explained in just about every budget meeting. But this is generally due to staffing issues, and the annual budget now is at 170. And that we just don't have, given the workforce limitations and the facility limitations, that you only have 170 now, which is, is common to me at where my mother is now. The administrator there asked, what's going on at Riverside, because it seems like there was always a bed available. And now there isn't, that people are having to wait longer to get placed there.
That's for sure.
And yeah,
I don't want to interrupt your train of thought. So.
no, that was just,
Can I
yeah,
mention one other quick
Yeah.
thing? And Rockingham's the same. Unless it's changed substantially in the last number of months, they're same size.
yeah,
And they were the same number of beds. In occupied beds. So it's not just Strafford, it's Rockingham also.
yeah,
And actually for more notable reasons, Rockingham has less than 50% of their own employees.
What's their occupancy at Rockingham?
Almost the exact same as ours, about,
It's like 170.
well, no,
No,
no, they're
They're licensed.
occupants, they're licensed occupants.
Oh,
is the
licensed
Same as ours.
Like 215.
Yeah, and when I was there, they were in the 160s. And they have a higher reliance on, they use travel nurses, they use, things that we don't use. And, cause they spent over 11 million, when I was there, and they were spending almost $12 million a year on
Travel.
pool and travel nurses.
I have a question. My question is this, so there was a moratorium on nursing, and I lost my notebook, so I read this, so I can't, so if I'm way off, you can correct me. But there was a moratorium on nursing beds that was put in place. It's my understanding from the back of my brain from the article I read. Some of that was imposed because there was an increased standard on one-on-one care or care of patients, and I don't know what that means. But at any rate, the fallout from that was they capped how many new beds in nursing care.
You voted for it again this year.
Right.
Oh, that's good. Yeah.
The legislature-
I don't mean you personally,
Yeah.
I mean, and I have to be careful because I was chided at the last meeting for individualizing, this. The legislature voted to continue the cap for
So
the next 2 years.
so for 2 more years.
So-
And the primary reason though, I mean, let's be honest, is the state didn't want to spend any more money on Medicaid.
Right. So they capped the number of nursing home beds with a theory that we were going to expand home and community-based services for the elderly and chronically ill. So when they capped the number of beds, I negotiated the deal with Morton, so I know, on behalf of all the counties. So we capped the number of nursing home beds with the idea we were gonna expand home and community-based services for the elderly. Because back when we did that, there was some home and community-based services, but not what Morton had envisioned. And that continued from Morton moving forward through, and then Nick Tumpus created the CFI program.
Right.
Choices for Independence program, which is again, an additional expansion of home and community-based services, okay? But Ray's point is right on target. When they capped the number of nursing home beds, the reimbursement systems changed, everything changed, okay, when that occurred. Now, at that point, Strafford County was underbedded by 100 beds. Because the old CNN board at the time, the CNN board was abolished, but at that time, they had also issued a CON to Exeter Hospital to build an additional 100 beds here.
So we were only at 115 at that.
No, this isn't Riverside, this
This
is
is
a
the
Okay,
CON for
The whole state.
Stratford County.
so Strafford, when they do like and this is like kind of my next question. They're dictating that Strafford County only can have this many nursing beds?
All nursing home beds in the state, the number of nursing home beds, Medicaid beds has been capped. Okay,
The total number of nursing home beds has been capped.
right,
And the theory was, as George had mentioned, they were going to be supporting CFI.
right.
In this budget that the legislature passed,
Right.
there was no additional money.
There was no
for
additional
CFI.
money for the CFI.
And in fact, I think what you'd find is the Healthcare Association, which is all of the non-county nursing homes, almost every non-county nursing home is part of that group, is a very loud advocate for nursing home funding. So over the last 2 or 3 governors, the money that has been available for long-term care or for care of the elderly, let's put it that way, has been focused on enhanced nursing home payments and not for CFI. And this year, this biannual budget is an exact replication of what's happened over the last two governors. It might even be three governors.
Right.
That, there's been no money put in the system. As you can see from the documents that I've given you, we actually have two facilities in Strafford County that take CFI patients, because remember, they're reimbursed at a lower level.
CFI is lower level than.
No, but you have to be nursing home eligible.
Payments.
That's right, the payment source
Payment source.
is. I thought it was fascinating when I did the research on the payment source, that it actually, the private pay CFI, facilities, and it's documented in here, actually charges more than Riverside does. On a daily basis. That's in these documents that was sent to you. But not all facilities take CFI because it doesn't make the payment. Just like Medicaid doesn't make the payment in nursing homes. And in fact, there's two facilities in Strafford County that accept CFI patients that are totally vacant.
So, okay, excellent, they're open.
They're open, but
They won't
they
pay.
have no admissions.
How does, are there people in the building? It's an empty building.
No, it's an empty building.
So I wanted to back up just a second because there's
That's
totally, it's a little hard for me to comprehend that. But like, so right now, the number of nursing home beds in the state is completely frozen.
Right.
So that applies to private too, does it?
Yes,
Or does that
correct.
apply? So-
Yes, it
So you
does.
cannot build a new private bed.
You cannot get you cannot get licensed by Medicare or Medicaid, and that's in state statute.
So I don't mean to, could you do it for if you do not accept Medicaid or
Then
Medicaid,
it's unregulated.
then you
Then
can,
it's unregulated.
okay.
I don't know how you'd exist.
But you, I mean, in theory,
In theory, you could exist, I guess, but I don't know how you could exist.
Well, how they exist is at the end of the day, unless you're like Riverworks, you have a model like Riverwoods, sorry.
Yeah.
Riverwoods. A model like Riverwoods, where somebody gives you $500,000 and you charge, and you have the wherewithal to pay, $6,000 to $8,000 a month on top of the $500,000. Then they will keep you there until the end of life. Now, there's been some exceptions to that,
yeah.
but that model will work when you have a pile of millionaires. Okay, because
Yeah,
they can transfer the cost once somebody gets really, really, really sick.
And it's absolutely a beautiful facility.
Yeah,
I
they do a great job. I'm not
Yeah.
saying anything bad about Riverwoods.
Expanding.
They're expanding
Yeah,
wherever they can. It's a great model, but the problem that happens is if you don't have $1 million to get in the door, you ain't getting in the door.
Now, can you transfer, theoretically, all of the slots for nursing care in the state are locked in at its current cap?
Yes.
Is it transferable from facilities? So in other words, like our facility is licensed to do 215 beds.
Right.
And we're only doing 170. Could you transfer in theory the 45 beds to another facility?
No, they can buy it.
They
from
can
us,
buy it.
but-
They can
but
buy
they
it.
Can't transfer it.
Right. They could buy it. But they're not gonna pay you anything for it because they're Medicaid reimbursed. They don't make any money at it. That'd
Because
be
there's-
like you buying
There's not enough private pay people to support,
to offset it.
to offset that. If that was the case, what they would do is go to Riverwoods or, someplace that.
Right.
The reason I ask this is like, okay, like, so theoretically, I have heard a potential idea of downsizing, our facility
Mhm.
and transferring, I'll just
A
throw the
license?
number out there. Let's suppose theoretically that and I think you just kind of answered the question. We said we're gonna cap ours at 170, but we'll sell you the other 45.
They won't pay, they won't pay for it.
I can't imagine in the current climate where Medicaid is so drastically under reimbursed. And the number of private pay people, are being absorbed by the private nursing homes, understandably so. Just, please don't infer that that's somehow wrong. I don't blame them. They have to stay alive, they have to stay in business. Those people that have the assets to pay are quickly absorbed in the private nursing homes. And we support that.
Yeah.
At Riverside, we support that. We
Right.
don't compete for those, ladies
Private.
and gentlemen.
Payers,
The commissioners have made a rule for me. If someone has more than 6 months worth of assets, we consider that a spend down. I have to get permission to admit them. Otherwise, if they're 6 months or less, I can admit them on my own, without their permission.
Yeah.
Because we don't wanna take away the private pay asset from the private nursing homes and have them go out of business. Because we support each other. The nursing home system will fail I can only speak for
Yep.
Strafford County. The nursing home system will fail in Strafford County if we don't take the Medicaid. That's why we're 97.2% Medicaid.
Well, the thing is, you have the ability to supplement
That's correct.
Medicaid because you can tax.
That's
correct.
That's exactly right. That's what keeps.
No, you got it.
But that's what keeps the
It's
system
not
in
rocket
place.
science.
No.
It's complicated, but it really isn't complicated.
Can I ask you another question? I'm sorry to dominate the conversation, but I just had a ton of questions, mainly because I am a neophyte at learning the Medicaid nursing system. So in terms of licensing of an assisted living, I assume that's a separate license.
It's totally separate.
Is there a cap on assisted
No,
living?
None.
That's why you have 2 vacant buildings, because they overbuilt.
They
What
overbuilt.
tips you from assisted living to nursing care?
ADLs,
Your ability to care for yourself.
called ADLs.
That's the bottom line.
Yeah, your activities of daily living, your ADLs. And that translates anything from feeding yourself, ambulating yourself,
Toiletry,
toileting yourself,
getting clothes, bathing yourself,
and taking your own medications,
taking your own med.
and your access to
Feeding.
to
Eat.
physician services.
Do they like come up with does somebody say finally, hey, I'm sorry, but you don't
Yes.
Yes.
you don't meet these criteria for
Yes.
assisted living?
That a number of our transfers come from assisted living. And also, state inspects assisted living facilities like they inspect nursing homes. And if you have someone in there that you can't manage, not only are you accepting the liability of not being able to provide adequate care for this person, but you're also subject to state scrutiny for, not being able to provide that care.
Could you, not another hypothetical. So you said there's these empty buildings. Is it theoretically possible to transfer those 45 units that are supposedly that we theoretically could have had at Riverside into those newer facilities and make that
You
nursing
could
care?
probably.
Well, they're not newer facilities. I think that's part of the problem. You'll note in there from the documents that I gave you that one of the facilities was full and then a new facility opened and everybody transferred to the new facility because it's nicer,
Yeah.
frankly.
Yeah.
And so they became vacant.
So it's essentially the same thing that we have in our own nursing home.
Well,
I mean, it's just if you build a newer facility, everybody's gonna go to the newer
It
facility.
all depends too on what their staffing patterns look like.
the thing that you try and the thing that you stress is, yes, the appearance of the facility is one issue, but the primary issue is the care in the facility. And not only the care, but the activities and a variety of things that are done that perhaps can't be done even in a brand new facility, particularly at the cost of a new facility. Remember, you gotta depreciate the capital, right? And Medicaid, while it does reimburse you as part of your reimbursement rate for your capital investment, it's capped. So it's nowhere near your full investment. In fact, and I know I don't wanna get too complicated, but if you remember when Lori Shibanet did that cost analysis for us, she capped the reimbursement at what the cap was at the time.
Yeah.
So how much of what we would have spent, she included that as part of the revenue that would offset the cost of the building.
Okay, I wanna go back to some of the
Sorry.
questions about, you said a nursing home and an assisted living facility are not allowed to occupy the same building.
That's correct.
Seems to me where the facility my mother is now, we transferred her there.
Yep.
Because they said, we can offer.
Yep.
And my mother has almost all of those ADLs, right?
I'm sorry, how old is that facility?
About 20 years old.
Their grandfather.
Okay, they still call themselves assisted living though, not a
Yeah.
nursing home.
Right, but I'll give you an example that I personally know of.
Yeah,
Rockingham has assisted living beds as part of their complex. It's in the same building as their nursing home, the walls are all attached.
Yeah.
A few years ago, when CMS came out with the rule that says that assisted living and nursing homes couldn't be in the same building, Rockingham applied for a waiver and got granted because they were grandfathered. They had that in existence before the rule. Now, let me give you an opposite example. Let's talk about Merrimack County. Merrimack County has the separate buildings because Merrimack County is a newer facility. It's not brand new, but it's a newer facility. And they fell under the rule, so their assisted living has to be in a separate building. Because we don't do assisted living, I didn't engage in CMS's reasoning. I figured that's up to Rockingham and that's up to Merrimack and they'll figure that out. We did work with Senator Shaheen and, primarily to, get CMS to grant waivers for buildings that had, the dual occupancy, let's call it. And so waivers were given, but it can't be now. So in other words, we couldn't take the 45 beds at Riverside and say, okay, they're assisted living, the staffing's less and we couldn't do that.
It had to be in existence.
It has to be in a separate building and it had to be in existence.
Yeah.
But you could, which is one of the things we had in the initial plan, is that when you build a new building, at least at the time, I don't know if it's changed, but you could build a new building and then take the old building and
Oh, yeah, you can do that,
Just
but you just can't put them in the same
you
building.
just can't put them in the same building.
Or in theory, you
Because,
could build two separate buildings.
That's right.
Correct.
Yeah.
But, one thing that, I'm curious about assisted living, and you said there's 21, 11 are private pay.
Yep.
One is private pay with some CFI beds, so they're saying, okay, we'll take some of you that are not private pay,
Right.
but is Choices for Independence, what the facilities pay for that, does that cover all of their care in assisted living? Or
Oh, no.
only some,
No.
just a partial,
Yeah, it's like Medicaid.
Right.
It covers partial care.
and so they,
And,
okay.
and the hope was when Commissioner McGlaris negotiated way back with Terry Morton, Janet would remember, Peter would remember when Terry Morton was a Commissioner of Health and Human Services, is that the state was gonna shift their funding
Right.
from,
Beds.
from the lack of nursing home beds,
Yeah.
in other words, cap them,
Yeah,
so that there wouldn't have to be any growth built in to the Medicaid system. Use that growth money for what's now,
What's now CFI.
what used to be HICPIC, Home and Community-Based Care for the Chronically Ill and Elderly. That's what.
The only
HICPIC
difference
stands for.
between CFI and HICPIC, the really only difference was on the choices of independence. Choices for independence, you had a choice of what you were gonna be able to do. Prior to that, your choices were very, very,
But the choice is only allowable if you meet certain criteria. I mean,
Right.
you couldn't be nursing home eligible and choose not to go into, I mean, you could choose not to
can
go
do-
to a nursing home,
Right.
but you can't go into
But
a.
the nursing home is like the last resort. Once you trigger those ADL things.
Correct.
There are no choices. The choice is nursing care, right?
That's correct.
That's correct.
So.
Or home,
Or
or home if.
Yeah.
With
you know,
assistance, with
A home with assistance, unless you know, have the assets to,
Pay.
do something different.
But they essentially wanted to lessen the, I mean,
Well, the theory was this, the initial theory was we cap the number of nursing home beds, we expand home and community-based services, HICPIC or CFI.
Mhm.
Let's just call it CFI now, but at the time was HICPIC. Because the state's cost was at the time, was a 3-to-1 savings between nursing home beds
yeah,
and HICPIC, okay? It was 3-to-1 savings to the system. So when we agreed to cap the number of beds, there was I debated more for 2 years over this, in capping the beds and expansion of CFI, he was supposed to put his race in, they were supposed to put, we were on a trajectory with the number of nursing home beds that were being built, okay? He wanted to flatten out that curve, then take that trajectory that we were on, save that money and pump it into the HICPIC or CFI. That was the plan, because it was a 3-to-1. So we were supposed to be able to care for double the number of people that we were caring for by doing the home and community-based services.
A really good idea, by the way.
Yeah.
Yeah.
A really good idea. The problem is it was never
Never funded.
politically supported.
Correct.
so you
That's
didn't
correct.
actually increase the
HICPIC.
facility, the HICPIC part that was
Right.
supposed to take
Oh,
the
the
kids
CFI.
off, they
Right.
didn't fund. But we didn't
And
fund.
you still, the legislature still doesn't fund it.
And so what happened was you transferred that cost over time, you meaning the legislature, to the counties. So right now, we're paying those CFI costs.
$135 million.
Correct. We're paying
Collectively.
collectively, the
10
counties pay
counties.
for that,
And
because the
you-
state has no ability, no broad-based tax. They use the counties as their broad-based tax, the property tax.
So the counties would have to agree to pay more into CFI to make it work.
Well, we fight every year.
We talk about it every year.
We
We've been
fight
talking
every-
about this for goddamn 30 years, okay? This is not something.
You can do it though, you just would have to do it on your county budget, right?
Well, we fight as an example, this year, I was part of what we effectively call a traveling roadshow, where I met, myself and people from 2 other counties met with each senator on Senate Finance. Because what the House did, when they passed their when they passed their budget, they added 3% to that 130-something million, which, you know, is no joke, right? That's 300 grand or more for Strafford County. It's actually about 350 grand for Strafford County. We did have some offset because the state stole money from us a few years ago and we got it back. So there was some offset. So it's not gonna be we're not gonna run into next year with a
Right.
2% tax increase just to fund that. We traveled around because prior to this budget, the cap was 2%.
2%. It was in statute.
It was in the statute, but the legislature changed the statute and made it 3%. So starting July 1st, our Medicaid bills are up to 3%, 3% more than they were June 30th. Of course, you can see the problem for us, right? I didn't budget for any increase because the prior 2 years, there was no increase at all.
Right.
And this was all, I discussed this on ad nauseum with the subcommittee. So we were prepared for that 3% increase. And again, we tried to beg it down to 2, but it didn't work. Apparently I failed in my effectiveness in front of the
Now, one of the
senators,
historically, what would happen,
including 2 of
I
our
did-
own senators, by the way.
I did it for 25 years. I stopped doing it because once we were able to get the legislature to agree to a 2% increase every year, which is another thing I negotiated with the Senate and House leadership at the time.
Yeah.
We were just not gonna have to mess with it. We knew we could budget for it. It was planned. And then, they started messing with it again, and then Ray went on the road show. But prior to that,
Well, we had ARPA money and
Right.
so they
Yeah,
made
ARPA
no
money.
increase and then the ARPA money ran out.
ran out,
And,
forth, and
and the tax structure changed for, I
Yep.
think, business and profits
profit,
tax.
yeah, they eliminated.
And you guys ran out of money, so
Interest and dividends tax was
you dumped it
appealed.
back on the counties.
We are familiar, we lived through this.
Yeah, well, what I'm trying to do is tie it all together.
Yeah, I hear ya.
Together.
You
I
know,
mean, it
tie
was,
together.
I mean, the problem was is you had a conceptual framework of how to fix the problem, but you didn't fund the other
The legislature didn't fund the other side of it.
side of it. So,
I want to go back
Sure.
still to the assisted living
Yep.
versus nursing home beds, because I think this is one idea we had at the beginning of this special committee, just think about what other ways could we help seniors
Hmm.
in Strafford County that cannot afford
Right,
a place to live at the end of their life. And the idea that what we want is for people to be in the least restrictive environment that they can,
We agree.
right?
no
Um,
question.
and, could a county, run assisted
Sure.
living facility be something to be considered? Or if not that, a way that we could support a private nonprofit to, like, it seems we have a need for more assisted livings that accept CFI
Yeah,
reimbursement,
Except you have two vacant ones now.
but they're,
if we kicked in money, would they be vacant?
Well, you can't subsidize, you have to be careful, you
Right.
can't subsidize Medicare,
Medicaid.
Medicaid.
Right.
You can't subsidize
It's
Medicaid,
the total number, right?
you can't subsidize any, so if we accept Medicaid, okay, and, which is a CFI is a Medicaid program, if you accept CFI as a form of payment, we cannot no one can subsidize that. What used to happen in the old days before CMS put that rule in, kinda underhanded nursing home operators or underhanded HICPIC operators would say to the family, I'll take the Medicaid, you throw me, a
Number of
couple $100 a month and we'll take your person. CMS stopped that.
So we couldn't, like, the county couldn't say, look, it's cheaper for us to put this patient in your assisted living than it is to put it in nursing care. So let's suppose like Medicaid is gonna give $10,000. We couldn't say, you know what? And actually, we're paying part of that Medicaid, I assume. So we couldn't say, you know what? It's cheaper for us to pay you $12,000 instead of 10, and the county picks up the other two?
No.
You can't do that?
No, you can't do that based on CMS or Medicaid rules. The other thing is,
Okay.
you have to appreciate that people who qualify for nursing home care aren't gonna qualify for assisted living care.
That's
They're
correct.
not,
They're not the
their,
same.
their,
Okay.
their needs are too great.
They're ADLs, the ADL.
but in my mother's case.
Yeah.
I think she would qualify for, nursing home care, but they're still saying that she's an assisted living resident.
That's great.
So-
They're willing to
Take the lower rate.
do the extra work, and, to ensure that they can keep her. And there's a certain,
A little gaming going on.
there's a loyalty here.
Right.
These are our people. And a lot of times when they're your people, you'll go that extra mile, to keep them. As an example, I have not ever in 40 years discharged a resident from Riverside. Even though their needs have changed substantially. They're mine. I own those people and I own whatever extra care is necessary to provide for them that might not have been necessary at the time of their admission.
Where else would they go? Is there like
No.
nursing home plus? I mean,
No,
where do
hospital.
you go?
That's where,
That's why the hospital.
that's where we get the call.
Right, we get the call.
That's where Riverside gets the call and they say, we can't manage this person any longer.
You're the last resort.
We're the last resort. That's what we've been saying right along.
You've been
I'm
saying
gonna
that.
go back to that, the statement that you can't accept Medicaid if you get any other funds. But isn't the county effectively, by having this budget for Riverside, we're subsidizing the Medicaid,
That's correct.
right? We're paying for the land, we have this overall staffing budget. So
No question.
could the same be true that like if we provide the land or some other, like, how does a place like Mass Landing, which is an assisted living facility in Strafford County that is run by a nonprofit?
So this is the bottom line. If counties have tried to privatize their operations in the past, it was a huge failure. Okay, I can name you, there's 3 counties that tried to privatize that I remember. Every time they privatized their operations, let the private sector run, which is basically what you're talking about, okay? It would last 2 years, year maybe, year and a half, but no more than 2 years. And the system collapsed because they couldn't, this is what happens. Yeah, I'm gonna try to simplify this for everybody. Hopefully. The reason why the counties are in a nursing home business is to allow the private sector to try to survive, okay, in this business. So what we do is we take the sickest of the sick and we take them to Riverside once the private sector can't handle them or they're losing too much money with them, okay? So that's why we exist. So we are a partner with them. It's very simple, okay? Like that's the simplest way I can put it.
Yeah.
So no matter whether they're assisted living, no matter where they are in the continuum of care, the county is the last resort, okay? If there's money there, as I've already explained earlier, if there's money there and they have 6 months worth of, unless there are some exceptions to that, minor exceptions, then we let the private sector make the money. Now, that's hugely disruptive to the person who's getting the care, by the way, because they'll go to a facility, they'll get spent down, and then the facility calls us and says, you gotta take this person because we can't care for them. Now, they've already taken their money.
Well, that's
okay.
that's not for everybody.
Right,
I mean,
That's correct.
there's some
that's right.
easily cared for Medicaid people. They're
Right.
pleasant. They're, they can perhaps feed themselves. They might even be able to wash their hands and face.
That's right.
But in terms of being able to live independently, there's no way they can cook for themselves. There's no way they can do those other
Right.
things.
They
So
can't-
those easily cared for Medicaid are frequently kept by the facility because they don't need
Right.
the amount of staffing that you would need for somebody who's on the higher end of the care of Medicaid. So, and there is a judgment rendered. And the state and the feds review that judgment. It's called the MDS documents. It's minimum data set. Every resident has an MDS done, which if you printed it out, it's all done on computer. If you printed it out, it's 17 pages long, and it's a full assessment of the resident. And in fact, that's how your reimbursement rate is determined. And you notice everybody doesn't have the same reimbursement rate. Your reimbursement rate is based on several factors. The primary factor being the amount of care that a particular resident needs, as opposed to they still all qualify to medically to be in a nursing home, but some people
Behavioral issue specifically.
some people are need less care than others, but they still fall into that big category of not being able to live independently. So that's how your reimbursement. That's not the only way your reimbursement rate is determined, but it's the primary way in which your reimbursement rate is determined. The problem we have with Riverside, of course, is that we don't have any capital to
I'm sorry.
we don't have any capital to depreciate. We're all depreciated at, because the building is as old as it is, we don't get any. So people say, well, why, if Riverside's taking all these heavy care people, why is it that your reimbursement rate, is lower than X, Y, Z? Well, it's lower than X, Y, Z because they might be getting $15 or $20 a resident day to depreciate their building, and we're getting nothing.
Representative.
Yeah, I'd just like to question the commissioner, that statement. It's hard for me to believe the reason we had a nursing home created in this county was to protect the private nursing homes way back when.
That's correct.
Whenever the
But we
first
had,
nursing.
no, we had welfare. You had welfare back then. Now, prior to Medicare and Medicaid being created, the counties took care of all these people at 100%. Then what happened was that when Johnson started the Medicare system and then it was continued by Nixon, what happened was there was a big debate here in every county in the country, including New Hampshire, because the feds were gonna start kicking in money to take care of people. There was a big debate, and this is all in the county's record, you go back and look at it, as to whether or not my Uncle John was here, my Uncle John was chairman of the delegation, as to whether the county should run hospitals. Now, when you go down south, counties run hospitals, okay? There was a big debate in New Hampshire whether the county should run hospitals. Because we were running a hospital. You had an alms house, you had a nursing, you had people that couldn't take care of themselves. You had the mentally ill, you had some mild Alzheimer's back then. You had all these people in the alms
That's not
house.
what I'm asking, but what you said is the reason we have is the altruistic
Well, I'm
reason of.
I'm trying to answer your questions. I'm trying to answer your question. So just hear me, just listen to me, just a few seconds, and you can tell me whatever you think. The bottom line here is that the counties, there was a debate held as to whether the county should be in the hospital business or not. When they decided that they weren't gonna be in the hospital business, okay, you had this population that had to be cared for. So this was a way of getting, when Nixon created the Medicaid program, which is a bastard child of Medicare, okay? When he created the Medicaid program, there was a way to draw down on federal money to help pay for these people who were sick that the county was paying for. So then the counties collectively decided at the time to run nursing homes, okay? Take the sickest of the sick and then allow the private sector to make money. Okay, that's the reality of it.
Nursing homes weren't created.
Yeah.
County nursing homes weren't created to work cooperatively with the private nursing homes. That's something that developed
Over time.
when the state, remember, the state funds Medicaid at 70% of the cost of Medicaid. And Medicaid in and of itself doesn't pay on its own. And the fact that the state only funds 70% of it is called, so the state looks at our cost report, not just our cost report at Riverside, but every facility in the state. And then they see how much they extrapolate that using the system that I described earlier about how much it costs you to care for somebody and how sick they are. And then they say, oh, we don't have enough money, so we're only gonna fund you 70% of that. So not only do facilities not get fully paid for their Medicaid person, there's a 30% penalty on top of that. It's called the budget neutrality factor. And that factor is, it makes it state hasn't appropriated enough money, so now that 30% varies. It could be 28.9, could be 31. It just depends on the year and what the cost reports say.
I mean, to answer, I'm just gonna try to answer your question, even though I don't know anything about nursing care. I would change that the county doesn't exist to let the private sector survive. It's the system is adapted to the funding. is the better way to say it.
Mm.
So if you have, it's a bifurcated system. If you have money, you supplement Medicare with your own private funding, and that pays for your care. If you don't have money, the county pays for you, and that's the system that we have, and it's evolved around that. I think the challenge that I'm seeing, as I'm trying to wrap my brain around this, is that, when I looked at your, how many beds of nursing care that we have, and it's clear that are probably gonna need more, but we've capped the number that we can actually build, so you can't build any more to meet that. And you can't do adapt assisted living to meet that need, so you're kind of in a box right now, is the best way. And there's no money to pay for anything,
Well,
even if you wanted.
And that's why you're hearing, not so much in Strafford County, but you're hearing the hospitals screaming that they're keeping people for months and months and months that don't belong there because there's no nursing home beds to put them in. We work really hard with Wentworth Douglas and Frisbee, and it's a quid pro quo. I mean, let's be honest. They take by the end of today, I'll have 3 people at Wentworth Douglas, that need hospital care. One's coming back, so as of right this minute, it's 4, but one's coming back today. So, I mean, and we try and work with Wentworth Douglas to take people, from them that need nursing home care. But still, in some cases, there's been people that have sat there for months. And Wentworth Douglas is losing their shirt because they're not compensated for that, because they no longer qualify for hospital care. They need, an alternative form of care. So, we try and work really hard with Wentworth Douglas and Frisbee. Frisbee seems to have less of a need, but Wentworth Douglas has in fact, there's 2 people right now at Wentworth Douglas that need to come in. We're just awaiting their applications and we'll bring them in.
Yes. A couple more clarifications. You said the state only pays 70% of Medicaid costs, and I think I've heard that before. And then I assume, okay, the county pays the other 30%. It's, no.
No.
Okay.
So let me tell you how that system works. It works fairly simply. New Hampshire's a 50% state. It's considered a rich state. I'm not suggesting it is. I'm suggesting that the feds say it's a rich state.
Right.
So they will pay 50% of the cost of Medicaid. If you go to a state down south like
Yeah.
Louisiana, they might pay 80% of the cost of Medicaid. But because New Hampshire's,
Yeah.
so that leaves the state to pay the other 50%. Now, the state doesn't pay the other 50%, the counties do. And that's the $134 million that the counties collectively, the 10 counties.
Do we pick up the whole 50, or is it a percent?
In some years, like in years of COVID, we picked up the whole 50. And in fact, I argue with you that we picked up more than 50.
Okay, but back to the 70, that's saying for those MDS, the care is this much money to care for this level of care. And then the Medicaid reimbursement is only 70% of
That's
that.
correct.
So 70% of the 50?
No, 70% of the 100 of the total.
Of
Okay.
all, and then that 70% is
Is
half paid
divided.
by the state and half by
Okay,
the county.
got it.
Half by the feds
Yes.
and half by the county.
Right.
Almost none of
The
it's,
state.
almost very little of it, maybe 5% is paid by the state.
Well, that's just set up to fail, isn't it?
Well,
It doesn't work because the thing is, the legislature is the wild card. The legislature is a wild card because they decide we are not gonna raise the amount of money that's needed because we can't do that politically. So they raise as much as they can get a positive vote of the legislature to adopt, and then the counties get stuck with the. Because there are always people out there
And-
who have no money, they have no money and they get cared for anyway. They don't get sent out into the wilds like the Indians, used to do. It was time for grandpa to go out and die.
And the other part of that is, in deference to the DHHS from the state, they guesstimate what the cost is going to be over the course of a year. So they give you a beginning rate in July, saying this is gonna be your reimbursement rate for the next 6 months. Then when the 6 months goes by, they look at how much money they have left over. And you could actually get a lesser reimbursement rate for the next 6 months because the state's run out of money for that particular year of the fiscal year.
And then does the county make up the difference?
No, everybody's rate goes down. Whether you're a county home or a private home, your rate will just go down.
I understand the rates, but who makes up the delta? Cause your cost didn't go down,
Property
right?
tax,
Nobody makes up the delta. You lose the money.
you lose revenue.
You
Well,
lose revenue.
You lose the revenue, which then passes the cost to the county taxpayer, right? Cause you can't run a nursing home in a deficit, not a county one.
That's right. And then what they do is they jack up the cost of the private nursing homes, jack up the cost of the private pay patient to make up the difference.
It's a balanced bill. It's
Balanced bill.
really no different than what happens to you if you have insurance. Right? If you go in the hospital and you have insurance, your costs are inflated to cover the costs of the people that are hospitalized without insurance.
Right.
I mean, let's just be honest about it. That's the way the system works. I'm not saying that's good. I'm just saying that's the reality of the system.
I wanna go back to, still trying to work through a lot of this data. Where are the two, vacant assisted living buildings in the county?
Northern part of the county. I believe one's in Farmington. I'm not sure where the second one is. I'll find out for you, but I'm not sure.
Yeah, it was a 40 bed facility in Farmington. We looked at it, we looked at buying it to put the homeless center there.
Sure,
But
but that's still
the
vacant.
town wouldn't,
I'm sure as of last week it is. We literally called every one of these facilities. That's why it took so long to put this together.
Yeah.
And most facilities were very candid, gave us the information right over the phone. Some facilities were less candid and they had to like check with their higher ups to give us the information, but eventually we got all the information. But it took a while. It took some perseverance to get this information.
And then there are places like Covered Bridge, which is not assisted living.
No,
But they do have a few residents that receive CFI.
yes, that's correct.
And so. I
The
wonder-
advantage, of course, with Covered Bridge is they're a HUD funded facility, right? So if you make HUD, here's the interesting thing, you can have as much money in the bank as you want.
right,
But based on your monthly income, HUD takes a percentage of that monthly income and calls that your rent.
Yeah.
So if you make $2,000 a month, you might pay $600, and I don't know the percentages, so I'm making it up.
if I remember, it's 30%.
Yeah.
Yes, but if it's 30%, then they pay you $600, but if you make $1,000 a month, then they only charge you $300. So
Yeah.
you could pay half as much as your neighbor
Yeah.
next door.
Yeah.
We worked, really hard to get that, and what we did get out of it though, which makes me quite happy, is that if we do have a resident that can be discharged, we have one right now, we become at the top of the list for the Dover Housing Authority. We move ahead of the whole list if they're at Riverside. Cause the list now is like 3 or 4 years.
They're at Riverside, but are able to live more independently.
Right, they got that.
It does happen on occasion,
Yeah.
maybe once or twice a year, where
Yeah.
somebody makes I wouldn't call it a miraculous recovery, I'd call it a surprising recovery, in the sense that wasn't the prognosis from the hospital, from the physicians. But it does happen, and we have one right now, and it makes us all very happy to deliver the application to the Dover Housing Authority, saying, here, we have and we will go out and I use the money from, we have fundraising, a memorial fund. our occupational therapist and our dietitian will go out and do shopping with this person because they haven't shopped in however long they've been at Riverside. And, you know, we have the bus route. So this person can jump on the bus route, you know, right there at the corner. And we help them, you know, pick nutritious meals and make lists for them. And we help them get furniture and all those things, which is, we consider that a great success.
Do you have that same thing with the Rochester Housing Authority, or is it just Dover?
It's just Dover simply because we're in Dover. And because we gave, you know, Dover, used to be more involved in the running of Covered Bridge. They've privatized that a little bit more than it used to be, but that was the deal that was cut when the county signed the lease for Covered Bridge.
So HUD funds were used to build that.
Yes,
Can HUD funds, and this is.
gone.
Oh, God.
Okay,
You have a new administration now. HUD funds are gone.
Yeah.
it's gone.
And we did
Okay.
away
So
also,
they can't help build assisted living.
in theory, also, what we did away with is, there were housing champions funds that were designated for, housing champion communities were first in line to collect the money to build new facilities. And, Dover just so happens to be designated as a housing champion. There were 2 rounds of funding that went in. I don't have the exact number off the top of my head. And I'm gonna say the legislature, even though that would be, I always feel weird saying that because that would be us. We cut all the funding. It was initially supposed to be $10 million that would have gone into infrastructure money, and we cut it all. So there's no, so in theory, we could have, any land that was on county property that we turned over or leased to Dover would have fallen under the housing champions, and we would have been able to catch money.
And I know we've said this 5 times, but the bottom line is, when Terry Morton was Commissioner of Health and Human Services, he wasn't the most popular person in the universe. In fact, there was no question he was gonna get
Was that ever the case?
he wasn't, there's no question he wasn't gonna get reappointed. But one of his more brilliant ideas was to freeze the number of nursing home beds. Use the money that would have gone into supporting those nursing home beds into the future and put it into again, let's just call it CFI. It wasn't called CFI back then. The problem is, he was so disliked by the legislature that they never followed through with the idea of adding the funding to the CFI. And if nothing else, the CFI could have perhaps delayed
That's what I'm
nursing
thinking.
home placement.
Yeah,
You know, because the people would get some support, and that amount of support that they got could have been enough to push out the failing of their health.
the inevitability.
Yeah, it could push it, you know, and, you know, some people would say, oh, you're just kicking the can down the road. Yeah, you're right. You exactly are kicking the can
Because it's
down the
cheaper.
road. Because it's cheaper to do.
So there's no, and then just to follow up on this, there's no permits or nothing going online of assisted living using CFI in Strafford County.
Well, I wouldn't, as far as I know, no. In fact, humbly speaking, I think Representative Wall will know that one of the last places that was built was in her backyard.
Oh, yeah.
Literally in her backyard on
That chicken house.
on Route 150,
Yeah, Carriage Hill.
on Route 155 was
Yeah.
one of the was one of the last places built. You know, when there's vacant places, it doesn't attract.
Carriage Hill is one of the CFI facilities. And it's private.
So it's a shared, yeah, it's privately owned, but it does take CFI.
Okay.
Can I ask one question? I don't mean to pull us off the assisted living. I was gonna ask about Riverside's census. So it's currently at 170. I think in the
Now, you will need to appreciate the 170 is bed capacity
Okay.
is okay, but I could have 3 or 4 people in the hospital.
Right.
So, you know, if you said, how many people are in there today?
No, it's kind of like when you do, education, when you do schools, they do like, in October, they do like a count, which is
Yes.
supposed to be an average of what your year is. So I
Well,
assume it's something
mine's every day.
every day. So nonetheless, let's just, for argument's sake and simplicity's sake, say 170. I looked at the report, the economic feasibility of bonding 130,000, which was the report that we got.
130 million.
130 million, excuse me. It had like census back from pre-COVID to COVID.
Yeah.
Have we ever, in terms of average, just simplifying it, gone over 170 in any of those years previous to where we are now?
Pre-COVID.
Pre-COVID.
Oh, yeah, I've used to budget as Representative Wall will tell you, I budgeted for 209.
So I can't remember.
You know, 209 as a
And we have
census.
waiting list.
And we've had waiting lists, and the 209, the reason I had 209 was, because, you know, I'd always have somebody in the hospital, and frankly, and if you think about this, morally speaking, if you had somebody, everybody had roommates. If you developed a relationship with your roommate, or even in respect to the family of the person who died, you don't fill it that afternoon.
No.
You know, you might give a day or two to the roommate to adjust to the fact that they're somebody who could have been their roommate for years passed.
Yeah.
So when I budgeted for 209, it was with the theory that we'd have 3 or 4 people in the hospital at any one time. And we have remember, we had an average between 80 and 100 people a year that passed at Riverside. So, you know, I factored in the idea that we would give a courtesy couple of days before we filled the bed, and we'd have some people in the hospital. That's why I never budgeted budget-wise for 215.
But so it went from 209 and it started to decline. COVID really took a.
143, I think, was our lowest at COVID, and that was the feds. The feds said at the beginning of COVID, they said if you had COVID in your building, you couldn't admit anybody.
Okay.
So then the feds, over a year and a half, lightened up and said, you can admit somebody as long as you don't have COVID on that unit. You know, because as you know, we have 5 nursing units, 6 nursing units at the time. And they said, as long as you don't have COVID, but it's not as simple as taking a nasal swab and saying you don't have COVID. You have to wait a week.
Yeah, no.
You know, so I mean, COVID was, you know, the factor. We only lost 1 resident that died as a result of COVID. Although we had at times 50, 60, 70 people that had COVID.
Oh, yeah, no.
You know, we only lost 1 person as a result of COVID. And frankly, I'd argue that.
But we load at 146, we've rebounded 143, we've rebounded to 170. Do we have a waiting list right now?
Yeah, yes.
Which brings me back, I wanted to comment about the, Carriage Hill. It was a place that we looked at for my mother because it's new and it's small. And they said our waiting list is 8 months.
Yeah.
Private pay facility, we can take you right now. So I think that
There you go.
our
There you go.
numbers of what, like how many beds are available in the county are not really reflective of the need for low-income people to find the housing or care that they need versus the privates pay. And that is a huge problem.
Does that hold true also just for assisted living?
And assisted living and nursing homes.
I mean, they're both in the same boat?
Yeah, if you're, and please don't see this as a bad thing. I mean, these people need to survive. And as we've mentioned before, Medicaid, when you do your Medicaid cost report, as an example, it doesn't allow me to pay for doctors. They don't call that a Medicaid expense. I mean, that's ridiculous. You know, So, I mean, of course we have to pay for doctors, but they don't count that as a Medicaid expense. Then they have you do your Medicaid cost report, and as I said, they pay you 30% less. Anywhere from, over the last number of years, it's been anywhere from 28 to 31%. Budget neutrality factor is the phrase
To
it's
be
called.
hit hard by the so-called big beautiful bill, which I think is the big awful bill, because that 3 months, when you admit someone and they apply for Medicaid, you're able to bill back for 3 months, and that's gone. So now we're gonna,
We were able to bill back for 6 months, now we're down to 3 months.
and now it's going
To
to
3
none.
months, yeah.
It's going to zero, right? We're not.
No, it's going back to 3.
Oh, okay.
So it was 6. It was 6, and you also need to appreciate, as, we do some pre-screening for Medicaid to educate the families about what's gonna be necessary. As an example, 5 years of bank records. You know, the family needs to come up with 5 years of bank records. They need to, property disclosures. Medicaid's a very complicated system. And the state, and I don't know if you all will remember this, because it was a big item in the legislature. The private nursing homes offered to raise the cost of their licensure if the raised money was used for the state to hire more people to process Medicaid applications. Now, when that passed the House, by the way, when it got to the Senate nixed that and found some money. The problem is the state can't hire anybody. You know, they don't pay them enough. They're there for a few months, and then just when they start learning how to process these applications, these people quit. Because, and part of it is the pay is crappy, but also the pressure is tremendous. Cause you got all these nursing homes like us, as an example, calling you on the phone saying, hey, you know, and we're gonna be calling even more now that the big beautiful bill has cut us back to 3 months. Cause at least if it was 6 months, we could get back paid, you know, that 6 months once they were approved. Now you only have 3 months, and the state doesn't have any more people to process these bills. And that's something I'm gonna have to take into consideration when I put together next year's budget, is how that's going to impact us in revenue from the nursing home. So, in some cases, this sounds funny, in some cases, by the fact that we take a large number of Medicaid people, a number of the people that we take initially are already on Medicaid. So we won't get penalized for those people. But the people that aren't on Medicaid, you know, I'm gonna have to sit down in November and work with my admissions person and say, and we're keeping these statistics now. How long is it taking us? You know, what's going on? Fortunately, we stole, and I literally stole her. She had 40 years experience at Carroll County in working with Medicaid.
Yeah.
And I hired her when we had a vacancy. So she has all these contacts, all across the state. And that helps us get people on Medicaid quicker.
Yeah.
Is that,
So,
but Medicaid, by the way, still owes us $3 million.
What's the average length of time to get someone onto Medicaid?
Well, some are really simple. You know, some you can get on in 30 days at the most. Some are more complicated, particularly if they own a house, if they share the house with someone, that's not their spouse. The spouse is usually fairly easy. The federal government's created a thing called the Spousal Impoverishment Act. So it's pretty clear in the system how much the spouse can get, how much the spouse retains of the asset. That's pretty simple. The problem is when your kid lives in the house, or you have someone in the house that's living there that's challenged somehow. And then it's how, you know, they can't live alone. What do you do with them? So some of them are complicated. Unfortunately, if we don't take them those are the people that get stuck at Wentworth Douglas or get stuck at Frisbee. And I'm talking stuck for months.
Yeah, I've heard.
I'm sure you've heard of that.
Yeah.
I want to, just say, but at the beginning, we said we're gonna keep these meetings to 90 minutes, and I really wanna do that today. But we don't have that many, all of us here. So we have a little over 10 minutes left. I think we've covered a lot of the things that we had asked you to gather information for, and we're still gathering information phase. But Al and I had talked about, and Janet, of wanting to do, field trips for our next meeting. We want to look at Sullivan County because they put this big addition on, big renovation. So given our current, what current building costs out now are, that would give us the most, recent experience to look at what you can get for so much money. And, you know,
It's useful to go and see.
I think so.
A
And I
couple of
would,
us have already done that, but a couple of
Not
people.
Sullivan,
But not Sullivan.
I
it was
just,
the Cal.
I just did a big favor for Sullivan County Commissioners. I spent an hour and a half with them on Zoom, answering the questions at the request of their county, administrator.
Yeah.
So I have every confidence that that county administrator would happily welcome,
yeah,
the legislators from here, although understand it's a hike.
and I would also like to visit Merrimack County Nursing Home as well, which, only a few of us went to that field trip where there was a pretty good representation to the visit at Carroll County. I don't feel like we need to visit that one again, but I would like other people to see, the Merrimack County.
I covered Merrimack County, that'll help us.
Can we,
And
I'm sorry.
so, but I am wondering, is there any county van that could be provided that we could fit a lot of people on, so we're,
Yes, we might need to
Give
take,
us-
we might need to take two vans, but depending on how many people go.
if people like that idea as opposed to
Yes.
sending many cars? I
Yeah,
think it would give.
Yeah, I'll provide a van and a driver.
How long would it take to get to Sullivan County?
Sullivan, I don't know. I've never covered that part of the state. Merrimack's hour and 10 minutes,
I've seen it.
Another.
Yeah, Bareback's like going to Concord.
I mean,
just a little further.
if
'cause
we
go
move
north.
It's like.
Yeah, if you do that, I'd appreciate it if it was on a Saturday.
On a Saturday,
I work.
Oh,
yeah, yeah,
Okay.
Well, I'm taking
Great-
away
great
from my
point.
business
Okay.
right now.
Yeah, I'm sure I can arrange that for a Saturday.
That would be.
I mean, if we could set that up, I think, I'm just trying to process what we just did in the last hour and 20 minutes.
I know.
But I think if we could do the field trip for October, and call in some favors and set up that we can go up to Sullivan County. At the very least, let's do that, but I also would love to go to Merrimack.
work on Saturdays.
Yeah, okay, yeah,
In your summary, and I'd like to give credit to Representative Holland. All this talk about Medicaid and Medicare and the present administration cutting money. Bottom line is, this money all comes from the taxpayers. I mean, really, when you think about it, it's not gonna be that much different if it came from this bunch or that bunch. And I tell people often, here's complaints, we sent $10 to the government, to the federal government, we're only getting back 8. What'd you expect? You're gonna get 11? Everybody's got their hand out along the way, you're paying for administration all the way. So you give 10 and you get back 2 and you think it's a good deal. The closer to home any of this is really the best, will come down to it.
yeah, but, well,
I'll start making some
most
calls.
taxpayers though are not gonna be able to
Well, I mean,
fund.
this whole conversation was really based about where the money's coming from, and it's like I'm sitting here, yeah, well,
It's
coming from
helpful.
us.
I mean, I think, again, I think having a chance and I really would appreciate, going to look at some other facilities is gonna be really helpful, I think. And also, I mean, it gives us an opportunity to hear how the other delegations have wrestled with the exact same circumstances, so I think it'll be
Okay.
helpful.
Especially Sullivan. Sullivan wrestled for years.
That's poor county.
Well,
I don't know
That's
whether
what-
you know it or
so
not.
Can you give me a target date?
we had,
Remembering that you
I
have,
think the 24th for our next October meeting. There are a couple reasons every other Saturday in October we're
The
not
Friday.
working out well for people.
Do it in November.
Can we
it might-
do-
yeah.
you could do it in November.
Well, does October not, if we did I think we said that we couldn't in October do any Fridays. In theory,
Except for the 24th.
could we do Saturday, the 25th?
Could we do the first Saturday in November? I can.
Yes,
I work Saturdays until November.
yeah, sure.
What's that date for the first?
Literally November 1st.
November 1st.
November 1st.
Yeah, yeah.
Yeah, I can make those arrangements.
And then can we do, all right,
Yeah, that'll give me plenty of time to
Well,
give
let
them
me-
notice.
We'll need to hear from the members of the committee that aren't here today, but,
Can I just caution you about one thing?
yeah.
Whenever you put out a date, somebody's not gonna make it.
Yeah,
And then they say, well, why don't you do this date? And then somebody else is gonna make it.
Yeah.
And then they say, well, wait a minute, you accommodated that person, why didn't you accommodate me? It's almost better if the chair or the chairs pick a date
Yeah.
and that's the date it's gonna be.
so that's what we ended up doing for this date, because we picked the date, it was already posted.
At least give people 30 days notice that.
But we'll try to pick this next date, clarifying by email. So as many people as possible.
I
can
would say-
attend, but we'll aim for November 1st if we're gonna go
That would
for
be
a
great.
Saturday,
Yeah.
which is a good idea for such a big time.
And this is my anniversary. Thank you so much.
Well, we hopefully we'll be back.
No, what I meant is my anniversary was the week before, would have been that Saturday before.
A field trip for your anniversary?
Yeah, that my wife would have loved
That
that.
should have been super sized.
Okay, that may be, and, yeah,
Ray, would you be coming on that? Because
Oh, yeah.
it would be helpful, yeah.
Well, not only that, I know the people,
Yeah.
and
Yeah.
I know the administrators, real well.
And you would know what's important for us.
Yeah, and I'll have the county, also have the county administrator, cause in every other county but this one, there's two people that do what I do. And I will have, I'm sure that both the county administrator and the nursing home administrator would be more than happy to attend with us.
Awesome.
okay, any other, questions or comments? People, yes?
You have to understand that this whole system is being kept going by me,
You.
because I'm eligible for all the stuff that we've been talking about.
Um,
But I live
Peter,
alone,
what's
I
your
take
address?
care,
Can we send you the bill?
take care of myself, I'm not costing anybody anything. So you just better be careful.
Just leave me your hat.
Treat me right.
Something happens, I want your hat.
Treat me right. Well, you already.
But at this point, I will make a motion to adjourn.
I second that.
All those in favor?
And I promise that certainly long before the November meeting, I'll have the documents that representative of Potenza is looking for.
Okay.
I'll continue to work on that.